Advocating for Our Professions is a module developed by Asha's Government Relations and Public Policy Board. In this presentation, you will learn about grassroots advocacy, why you should advocate, the difference between legislative and regulatory advocacy, how to become an advocate, and what support Asha offers you. Adding your voice through grassroots advocacy. What is grassroots advocacy? It's ordinary people working together to support a cause or position. A student's role in grassroots advocacy is to understand the importance of being an ongoing advocate for the professions. Participate in opportunities to learn about and engage in professional grassroots advocacy efforts. An example of student advocacy is coordinating a student group at a university to engage in grassroots advocacy. We are the experts of our professions. We can help educate elected officials and regulators. We are working toward greater success in implementing planned advocacy strategies, including legislative, regulatory, and media initiatives. We strive for an increased commitment to goals shared by audiologists, speech-language pathologists, legislators, higher education programs, and student groups. You need to be an advocate in order to share knowledge and expertise among students, professionals, and legislators. We want to encourage professional-student interaction with an expected outcome of increased cohesiveness for future grassroots efforts. Group advocacy has its benefits. There is strength in numbers. Legislative versus regulatory advocacy. There are two primary types of grassroots advocacy. The first is legislative advocacy. Legislators in federal, state, and local governments are responsible for developing laws and monitoring legislation. The second is regulatory advocacy. Regulators in federal, state, and local agencies are responsible for interpreting the laws related to our professions. Advocacy goes beyond legislation and regulation. The promotion and advancement of the interests of the professionals in human communication and those we serve. Advocacy is building relationships. The purpose of legislative advocacy includes working toward having a bill introduced, amending a bill that has been introduced, opposing a bill, or working toward having a bill enacted into law. Sometimes it may entail advocating for funding for an enacted law. Regulatory agencies can vary and function quite differently. Examples of regulatory agencies include departments of health, education, and state. Do not assume that even if there is overlap, that there is communication between agencies. Regulatory agencies generally issue regulations following a notice and comment period, where interested parties may submit written comments. This affords you an opportunity to collaborate with Asha and state associations in developing and submitting comments during the rulemaking process. Become an advocate. There are many communication vehicles used in advocacy. They include face-to-face meetings, fundraisers, phone calls, faxes, letters, and e-advocacy. E-advocacy is the easiest way to reach your members of Congress and state legislatures. It allows you to quickly and easily advocate for or against an issue online, including your mobile device. E-advocacy is an electronic take-action center. It allows Asha and state associations to send email alerts to their members and ask them to contact his or her elected representatives online to voice support or opposition on legislative bills or regulatory initiatives. Action alerts are created to alert members when action is needed. From there, members can use the email template that Asha develops or modify and personalize your message. After that, just submit it directly to your member of Congress, state legislator, or regulatory agency right online. You can also share the action with your friends and post to social media sites to help get the word out when action is needed. If you haven't already joined, please sign up to receive email action alerts when your involvement can make a crucial difference. Face-to-face meetings is another effective form of grassroots advocacy, but you must prepare. Lay the groundwork. Learn as much as you possibly can about your legislator background. For example, their political party, legislative committees served on in Congress, personal facts such as their hometown, education, and profession. These can provide insights into their view of the world. Most of this information can be found on their personal website. Contact your representative and senators. Call the member's Washington office and request a meeting in the local district office nearest you, or in the Capitol if that works for you. When attempting to meet with a member, ask for the appointment secretary or scheduler and explain the purpose of your visit. Explain who you are and why you want to meet. Identify yourself not only with a name, but as a constituent. State your city and state, your profession, and topic. Confirm your appointment. Some offices may ask you to send your request by email, whether you're requesting an appointment or confirming one. Be prepared for your visit. Review the Asha issue briefs posted under the Federal Advocacy section on Asha's website. Know the issue well and be familiar with how it affects your patients and the professions. Know all sides of the argument. Have the materials for your lawmakers in hand as you depart for your visits. If you are meeting with your senators, with other colleagues, decide in advance who will be the spokesperson and who will leave the materials. Be prompt and patient for your visit. When it is time to meet with your legislator, be punctual and patient. Lawmakers have very busy schedules. A late arrival may mean that you miss your appointment. However, it's not uncommon for a lawmaker to be late or to have a meeting interrupted due to the member's crowded schedule. Please be flexible if your time is cut short. Here are some points for an effective meeting. Identify yourself. Simply describe your subject. Focus on 1 or 2 points. State your position clearly and concisely. Express your views reasonably and don't argue. Tell personal stories. Connect the issue back to the district or state as much as possible. Thank them for co-sponsoring a bill. Don't be afraid to make an ask. You should thank the member of Congress or staff member for their time and consideration of your issue. If you met with helpful staff members, let your legislator know. Follow up with a thank you email and request to be kept informed about the issues you discussed. You can have effective meetings with the legislator. Check with Asha or your state association in sufficient time so that you can receive talking points about the issue and what the professional association would like the legislator to do. You can leave something behind, a business card, brochure, talking points, so that the legislator or the staff member will remember you and the issue. Keep in contact by sending an email or calling at least twice a year. Send holiday cards. If possible, attend local political fundraisers, events, and barbecues that are sponsored by the legislator. Be sure to write a letter of support to the editor of your local newspaper, describing your legislator's efforts, and send a copy to the legislator's office. You can also invite the legislator to visit your place of employment. Asha provides advocacy support to its members. Asha can support you with grassroots advocacy initiatives that have an impact on federal health, disability, and education policy issues. Asha can facilitate congressional visits, prepare talking points to facilitate knowledgeable dialogue with congresspersons and their staff, represent Asha on Capitol Hill before federal agencies and in the states, by lobbying Congress and assisting states in lobbying state legislators on behalf of the professions, increasing visibility of the professions to Congress and state legislatures, providing written comments on legislation and/or regulations of interest, and provide model bills for state legislation. Asha tracks and analyzes federal and state legislation and regulations that affect the professions. They coordinate grassroots advocacy initiatives for members of NISHLA and Asha. They develop and maintain a member grassroots advocacy network, educate members about grassroots advocacy, and provide a forum for discussion of issues through state networks, which include the State Education Advocacy Leaders, State Medicare Administrative Contractors, and State Advocates for Reimbursement. In addition, Asha's State Advocacy Team is available to assist states and provide support documentation. The Federal and Political Advocacy Team is available to assist you with your involvement in national advocacy efforts. Asha has in place several grassroots advocacy mechanisms of its own. 2 standing boards and committees, the Government Relations and Public Policy Board and the Political Action Committee, as well as regular collaboration with state associations. The Asha Government Relations and Public Policy Board develops Asha's public policy agenda with input from membership, provides advocacy training and education to Asha leadership groups, and communicates Asha's advocacy progress through the annual agenda and action. One of the major intentions of this module is to inform you about political action committees, or PACs. These are important committees both at the state and national levels. PACs are for supporting the election of individuals to public office who can impact policy change that will have a positive effect on the professions and the people we serve. The PAC raises funds for distribution to legislators to promote current professional issues. The Asha PAC Board facilitates the understanding of the necessity of PAC funds among professional members. If you want to stay up to date on the latest issues in advocacy, follow Asha Advocacy on social media. Be an advocate, speak out, and be heard. For more information on Asha's advocacy efforts, please visit the Asha website, call, or email grassroots@asha.org. We hope this module helped you so that you can have an impact on federal health, disability, and education policy issues as a student who will become an audiologist or speech-language pathologist. Please provide feedback or send questions or comments to grassroots@asha.org. At this point, you may proceed to the last module, Module 8, Advocacy and School Finance.